Hi guys. Lately I have been noticing that there is lots of interest about an incredible treatment called LYT or Lymphocyte Immunization therapy in various groups and fora and social media. And that's great, but I would like to clarify some things about this therapy because it is incredible as long as it is used correctly. So in order for it to be effective, you need to follow some guidelines. First off, you need to know whether LYT can be helpful specifically in your case, based on medical and fertility history and on the correct lab results. If misused, it won't be effective, and indeed, this may be one of the reasons why LYT is considered controversial. You need to find an expert that will be able, based on your specific fertility history, to decide whether you would benefit from this treatment. Secondly, you need to have the correct tests to decide whether LYT is needed or not. LYT must be decided upon primarily based on alloimmunity dysfunction testing. And this is very important. Let's say now that based on your fertility history, based on your medical history, and based on your test result, your specialist suggests LYT as a treatment for you. We now have to decide when to have our first therapy, our initial shot, and when to have additional booster shots, how many, and so on and so forth. You need to understand that LYT therapy is much more than the injection itself. Although it is important how LYT is prepared, how many lymphocytes are included in the injections, and together with your fertility expert to form a comprehensive, specific targeted treatment protocol, a strategy specifically for you. So, you need to decide when to have the first session. Then, your doctor will guide you when to have a second or even a third booster before your attempt. Let's say that you have this protocol, you had your initial therapy, you had one booster shot, but you failed to get pregnant. When should you get a maintenance shot? As you can see, things are more complicated. It's not okay just to have one LYT therapy and be done with it. It won't work. So, when you will have your initial therapy, when you will have booster shots and how many? Would you need a maintenance shot until you get pregnant? Then, once you get pregnant, would you need additional booster shots and when? So, it is crucial that you have a specific protocol planned especially for your needs in order for LYT to work. Let's say that we have succeeded. You had your initial LYT therapy, you had a couple of boosters, and now you're pregnant. What's next? You need to know that once pregnant, LYT needs to be repeated at specific milestones during your pregnancy, and optionally, you could have additional treatments based not only on your history and initial results, but also on ongoing test results called pregnancy monitoring. This will help you decide if you need to increase your treatment and to strengthen your treatment, or to stop it and avoid unnecessary costs and treatments. Keep in mind that not all women will respond in the same way with LYT. Finally, you need to understand that LYT will be more effective as a part of a comprehensive treatment plan and immunological protocol. It is very rare that LYT would be the only immunological therapy that you need. So your doctor needs to combine different immunological treatments with LYT in order to give you the best chances of conception and to prevent early and later miscarriage. Our team is very experienced in using LEAD. And we will provide you not only with all the help you need in order to set up the initial protocol and ongoing treatments, but also to monitor you during your pregnancy and to help you and be there with you to advise you all steps of the way. If you have any questions about LEAD, if you have anything that you would like to discuss, we will be happy to do this with you. You can send an email at customer care, or you can drop a comment on the section below. Until next, have a nice time, and we'll be in touch. Bye-bye.